Hi, and welcome to Lincoln Memorial University Radiographic Imaging. My name is Phoebe Bodwig, and today I'm going to talk about the hand. The outline for this lecture is as followed. First, we'll talk about normal hand anatomy. Second, I'll talk about identifying fractures by using the systematic approach. And last, I'll talk about developmental hand anatomy. Okay, so picture to our right, we have an x-ray of a normal hand. We are going to identify all the bones on this hand. To me, the carpals are particularly hard bones to learn, so I like the mnemonic, so long the pinky, here comes the thumb. I'm going to put this to the left of the screen for you, and then we are going to identify all the carpal bones in pink. So we have the scaphoid, the lunate, triquetrum, pisiform, hamate, capitate, trapezoid, and trapezium. And up here we have our flexor pollicis sesamoid bone. In yellow, we have our metacarpal bones. In orange, we have our proximal interphalanges. In green, we have our interphalanges. And in pink, we have our distal interphalanges. Okay, so before we can look at fractures, we need to develop a systematic approach to looking at an x-ray. I like to use the ABCs. A for alignment, B for bone, C for cartilage, and S for soft tissue. In order to correctly read this x-ray, we are going to implement our ABCs: alignment, bone, cartilage, and soft tissue. In this particular x-ray, we are going to focus on tracing the cortical outline of the metacarpal bones in order to see if there is a fracture. And as we go to our fifth metacarpal, we can see that there is indeed a fracture. The alignment is off. I'm going to circle it in yellow on the left-hand side, and notice that flexor pollicis sesamoid. The last x-ray pictured was called a boxer's fracture. Another way to tell that you have a fracture of the fifth metacarpal, or any of your metacarpals for that matter, would be the patient presenting with symptoms of no knuckle. This commonly occurs by punching something with a closed fist, hence the name boxer's fracture. And this typically occurs transversely across the metacarpals, more commonly the fifth metacarpal, which is what we saw in our last two pictures. We're going to trace the alignment of each bone by tracing the cortical outline, starting with our triquetrum, hamate. Our scaphoid is looking good. Capitate, no fracture there. Trapezium, trapezoid, and last our lunate. Go down to the ulna to see if there are any fractures occurring. And then last our radius, and we can tell that there is in fact a fracture, and I will find it on our right hand picture as well. So we can see that our radius is fractured, and that we have backward displacement of the hand. And from these two symptoms, we know that this is called a Colles fracture because of the classic backward displacement of the hand and the fracture of the radius. This is a Colles fracture like the x-ray we saw in the last slide. A Colles fracture is the most common type of distal radius fracture, and it is mostly seen in patients with osteoporosis and can also be seen in younger patients who have been involved in a high trauma. The common mechanism of this fracture is falling on an outstretched hand. In order to tell where the fracture is, we are going to trace the cortical outline of each bone, starting with the metacarpals. And so far we can see that there is no fracture. We will keep drawing them out. As we go to our metacarpal bones, we'll start with our triquetrum, go to our hamate, looking good, capitate, lunate, and when we get to our scaphoid, we can tell that there is a fracture. I'll denote that with a star and find it on the left hand. The scaphoid bone is the most frequently fractured of the carpal bones and actually accounts for 71% of all carpal bone fractures, often occurring from younger to middle-aged patients. Here is another picture of a scaphoid fracture. This is just showing a little more clearly exactly where the fracture occurs. The primary mechanism is falling on an outstretched hand, which is similar to the Colles fracture we just studied, except the difference here is that it's falling on a deviated radius, while on the Colles fracture it was falling on a pronated radius. Okay, now we're going to talk about developmental hand anatomy. This is a valuable tool for age estimation. From 1952 to now, epiphyseal plates are closing on average 3.5 to 4 years earlier. And a new atlas is being made to aid in better age estimation. This is a hand of a 10-month-old. Notice how he or she has no carpal bones. The ossification centers are circled in blue, and the epiphyseal plates are not present at this age. Month-old hand. Circled are the ossification centers, the epiphyseal plate of the radius, the epiphyseal plates of the proximal interphalanges, as well as the metacarpals. We also have epiphyseal plates on the interphalanges, as well as the distal interphalange of the thumb. Here we have the hand of a 3.5-year-old. Circled are the ossification centers, 2 carpal bones, and the epiphyseal plate of the radius. Note when we go to the metacarpal bones that the epiphyseal plates are on the distal metacarpal bones until you get to the thumb where the epiphyseal plate is located proximally. Now I will just circle the rest of the epiphyseal plates on this 3.5-year-old. Here we have 2 10-year-olds. On the left we have a female and on the right we have a male. I will identify all the carpal bones on the female and the male. So we have the scaphoid, lunate, triquetrum, hamate, capitate, trapezoid, and trapezium. When we go over to the male, I want you to pay specific attention to how far spaced the carpal bones are. This means that the male hand is not as developed as the female hand. And when I circle the epiphyseal plate of the ulna, I want you to pay specific attention to the styloid process on the female and note that the male does not have that. I will now circle the rest of the epiphyseal plates on the male and female hand. Here we have the hands of two 13-year-olds. On the left we have a female and on the right we have a male. On these x-rays I'm going to circle the carpal bones in order to emphasize how close together they are in the female and how far apart they are on the male. So here we have our scaphoid, lunate, triquetrum, and pisiform, hamate, capitate, trapezoid, and trapezium with your thumb. Now I'd like to note that on this male's ulna process, there is actually a styloid process. And if we look at the joint space, we can see that the females is much closer together and that the females have a flexor pollicis sesamoid and the males do not. We thank you for your time and we hope that this video was beneficial.